Today we're going to talk about the main cause of your back pain that you don't know you have. What does that mean? It's a little confusing, I understand. I've probably done 1,000 lectures, and in those lectures I ask people if they know what is the cause of their back problem. And 99% of the time our patients have no idea what stenosis is or if they have stenosis. And stenosis is probably the most common back problem that you don't know you have. Stenosis is a wear and tear of your spine slowly over time. It's a decrease in the size of the opening between the spine. So let's just do a quick review, because we're going to tell you what stenosis is, because if you have it, you need to know you have it. Typical spine, 24 vertebrae between the head and the hips. In between each vertebrae there is a disc. And what happens with stenosis is these discs start to break down, and then the bone starts to break down, and then the openings physically where the nerves come out of the spine get smaller, but also the opening inside the spine gets smaller, and the nerves start to get pinched. Now, stenosis is the most common reason for spinal surgery in adults. That's why you need to know about stenosis, because if you have stenosis, it's a problem. And very often stenosis patients wind up in surgery because it is the most common reason for surgery. And typically the rationale behind why surgery is done in these patients, because I don't think it's a good idea, but the rationale is stenosis is a progressive disease, meaning it progressively gets worse over time, and they've got to get that out of it. They have to solve the problem with surgery before it gets worse. But the studies don't show that that is a valid reason for why you should have surgery. And a lot of the studies that we've looked at, the Oswestry score is a very low score. And it's a low score because the rationale is it's going to get worse, so you need to try to solve it now. Why are we doing these videos? We do these videos because doctors are not obligated to report outcomes. So you don't know very often what is the best treatment choice for you. Our goal is to educate you so you can make better healthcare decisions. Trust me, you make a couple of bad healthcare decisions, it's going to cost you for a long time. And I don't mean financially, I mean emotionally and physically, because it's going to cause you a great deal of trouble and pain. So our goal is to help you make better decisions and make you better educated about your healthcare. Again, stenosis is a wear and tear. It's a narrowing of the opening where the nerve comes out. It's also a narrowing on the inside. It's a slow progressive disease. It's a disease process where the inside of the spinal canal physically starts to get smaller. And as it gets smaller, it'll start to compromise the spinal cord. So it's called the degenerative cascade. In the degenerative cascade, the discs start to break down, and the discs no longer support the spine, and everything starts to wear out. It's really just generally wear and tear. The more wear and tear you have, the more stenosis you're going to have. So very often, if it starts early on and starts to progress, you're going to start to have more trouble. Typical patients that come into our clinics. Okay, we've got 1,000 case studies now. 561 of our case studies had stenosis. And interestingly enough, of those 565, 84% also had a bulging disc. Why is that important? Because the bulging disc and stenosis are part of the degenerative cascade. And more importantly, the degenerated disc is very specifically part of the degenerative cascade. I don't want to make this confusing, but as things break down, you don't just get one change, you get multiple changes. So the two most common conditions that go with stenosis of our patients are both the bulging disc and the degenerated disc, illustrating that it is part of this degenerative cascade. It's a slow breakdown over time. Now, typically, patients that come in, as they get this breakdown, is they will start to have different therapies. And therapies of choice are physical therapy, chiropractic, cortisone injections, and narcotics. Okay? They don't solve the problem. The patients that came in to see us had gone through all these different therapies and not gotten better. And to compare our protocol and our process to conventional surgery for stenosis, very often we talked about one of the studies that was done earlier, and during that study, they compared oswestry before and after the surgery, which is a microlaminectomy for the stenosis, and what they found is the oswestry changed by 12.9, and total improvement, it went from 29 to 12, and total improvement was just about 17, okay? But here's what's important. What they found in this study was patients that had less favorable outcomes very often had the problem for a longer period of time. The average patient had it for 2.75 years. So what does that mean? It means the longer you have this problem, the more wear and tear you get, the less likely you are to get better. And one of the reasons they do the surgery is because it's progressive. But the problem is it doesn't help. And then higher oswestry disability index scores also had less favorable outcomes. Our patients, when they began therapy, they had a 46 oswestry, which is not quite double, okay? Because theirs was a 29, but it's a lot higher, almost by 20 points. And ending oswestry was a 9, so our changes were 37 points oswestry, 7 points pain, okay? So the point of all this is stenosis is a progressive disease, slowly over time breaking down, and that surgery is not a very good option, although very often they recommend it because it's a progressive disease. We have the ability to solve this problem. If you have stenosis, give us a call. We can help you.